Hospitals in the southeast are returning to normal following an unprecedented spike in emergency department admissions. But angry patients and politicians are demanding the government come clean over how the system got to crisis point in the first place.
The worst of the hospital crisis is now over, but the finger-pointing has just begun.
When will the Premier take responsibility for Queensland hospitals and admit the system is in crisis?
You can call it emergency, you can call it crisis, Mr Speaker. I accept my responsibility and I expect the federal government to accept their responsibility, Mr Speaker.
The state has been grappling with all 10 public hospitals in the southeast being at capacity. During the first 3 weeks of March, there's been an influx of presentations to emergency of more than 53,000. In February, the total was almost 60,000. Crunching the numbers, that means the hospital network has been swamped by an extra 3,000 people a week this month, enough to tip it over the edge.
People aren't renewing their private health insurance as much. And why is that? Because premiums have skyrocketed.
On-call home doctor services have been overwhelmed by sick people needing their help.
It's been probably a year since we've seen that kind of increase in demand for our services.
But by mid-morning, the Premier had declared the crisis over.
All code yellows are now off our southeast Queensland.
Still, patients and pollies want answers.
How many sick Queenslanders are being treated on trolleys, chairs and in corridors?
Why did the Palaszczuk government fail to plan ahead?
Why didn't the Premier act on Dr Judkin's dire warning over 2 weeks ago?
The Premier's responses weren't that well received.
So rude. You are disappointingly rude.
And with the winter flu season just around the corner, practices are being put in place now to avoid a crisis replay in the coming months. A chilling prospect for those on the front line. Tegan George for 10 News First.